All right, well, many people are suffering from hay fever as the spring allergy season getting well underway. So how could we reduce the misery, the sneezing, the coughing, all those itchy eyes? Dr. Jen Caudle is a family physician and an assistant professor at Rowan University School of Osteopathic Medicine. Thank you so much for joining me.
Thanks for having me.
So certainly people are suffering right now.
Myself included, I have to say. It's that time of year.
And where do they come from? It can't be bad karma because my husband's the nicest guy. He's got the worst allergies.
I'm sure he is the nicest guy. There's so many people out there suffering with allergies, and right now the pollen counts are pretty high. You know, allergies I think are kind of tricky because what happens is the body responds to pollen and grass and weeds and things like that almost as if those substances were intruders. So it's almost like the body tries to attack them, and it causes chemicals to be released, and we get the itchy, watery eyes and the runny nose and all of those things that many of us are suffering with right now.
And what are the symptoms, and how can people tell them from other cold symptoms? A lot of folks that suffer from allergies, they get them every year.
Right.
They can feel them coming on.
Right.
Week to week to week, they feel the dread.
Right.
So how can they identify that and make sure they're not actually sick with something else?
Well, that's a good question because, I was in the office actually this morning and I saw a couple of patients who had that very question. They said, I'm not sure if this is my allergies or a cold. So the symptoms of allergies, itchy, watery eyes, sometimes a scratchy throat, nasal congestion, you're sneezing, you're coughing, maybe some clogged ears. But you might say, well, gosh, this sounds like a cold.
Yeah.
And there are some differences. Often allergies will come on quite suddenly, where a cold will take a few days to come on. You're not going to get a fever with allergies like you will a cold. So there are a few other things. And then, colds and stuff will usually last 7 to 10 days or so. Allergies will last for as long as you're exposed to the allergen. So those are a few things to help set them apart.
Is there anything you can do to stop it?
Well, yes, that is the million-dollar question here. Prevention and avoidance is key. This is the time of year, the weather is nice and we want the windows down. But for those of us who suffer from allergies, the windows need to be closed in the house, in the car, because pollen just comes inside. Make sure you check the pollen counts before you go out to cut the grass or whatever. And if you do, come back in, take your clothes off, throw them in the wash, and rinse yourself off. Those are some things that we can try to do. And make sure you're not wearing the shoes in the house to track the pollen around. And then medications, of course.
Yeah, and medications. Is it over-the-counter medications, or can you take it up a notch?
Yeah, so I like that phrase. So you can do both. You can do over-the-counter and you can take it up a notch. We do have prescription medications. Some of my favorites are nasal sprays. Many of them are over-the-counter and prescription. Steroid nasal sprays are wonderful. They help with that congestion. And it's not the steroid that's going to go all over your body and make you gain weight. And people get concerned about that.
When you hear the word steroid.
Right. Yeah. It just stays right in the nose. So that's a great one. Also, saline nasal sprays or neti pots. Those are great. But there are also pills like non-drowsy antihistamines are really good. And those are both prescription and over-the-counter too. I think my biggest thing is for those of us, I'm going to throw myself in that category, for those of us that are suffering, you don't have to. And really keep going, because I have some patients that their allergies are so bad, they tried every medication in the book, but we need to give them allergy shots or get them allergy tested. And there are many things that we can do. So that's important.
And is it trial and error? Was it a type of thing where something might work for someone but not for someone else?
Yes, I'm so glad that you said that, because, for some people one antihistamine works wonderfully, and then for the next person it doesn't work at all. Or some patients will say, I was using this antihistamine for years and all of a sudden it doesn't seem to be working anymore.
So it can wear off, the effectiveness?
Well, maybe the way we respond to it can just change over time. And so sometimes we have to change up our medications and try new things and step it up a notch, as you said.
So I'm one of the fortunate few. I'm a non-allergy sufferer. I don't get the seasonal allergies, but my husband, his whole face gets puffy. So can I help in any way? You mentioned take your shoes off, so there are some things where maybe I'm bringing the evil pollen into the house.
So besides giving him sympathy, providing lots of sympathy, yes, not tracking, not wearing shoes into the house. Other things like sometimes animals, we forget about our little furry friends, sometimes they can track pollen in as well. I think things like that, if you have a humidifier at home, make sure the filter is kept clean. That's really important, because sometimes dust and mold gets caught up in the humidifier. They do a good job, but if they're not kept clean, they can actually make things worse.
Those window air conditioning units, those too?
Well, you got to be careful, because it just really sort of depends on the person. But these are all things to kind of be thinking about. So, yeah, just take it easy, and sympathy goes a long way, though.
Sympathy goes a long way. I don't know if a lot of folks out there are going to be seeking the sympathy. I'm sure they'd rather have the drug that works for them.
That's true, and they can get that too. Absolutely.
All right, thank you so much.
Thank you.
Dr. Jen Caudle for joining us and giving us some tips to help people survive this crazy allergy season. We appreciate it.
Thank you.
Eric?